This is Psychology Radio, of course. We're going over some of the things so you can get an A on the test. I am Tabula Rasa, and specifically we're talking about Chapter 16, or the treatment of psychological disorders. The first section is about getting treatment, or why people maybe don't get treatment. The first reason is that people may not realize their symptoms need to be or can be treated. The second one is they might have barriers to treatment, beliefs or stigma that prevent a person from getting treatment. And the third is people may not know where to look for services. So the first one is they might not know they need it or that they can be treated. The second one is they have a barrier like a belief or a stigma. And the third one is they just don't know where to look for it. 1 in 5 adults does have a disorder at some point in their lives, so it's always a good idea to move past those things so that you can get what you need. The next section is psychotherapy. They can do group, individual, couples, or families psychotherapy. And the goal of psychotherapy really is to just get a different approach to help better understand the symptoms a person is experiencing and beginning to think about those symptoms differently. For example, talking about events from childhood and how they relate to recent relationship difficulties, that would be part of psychotherapy. They have behavioral, which is where they assume behavior is learned and that symptoms will improve if new or if learned, more adaptive behavior occurs. So you can learn yourself out of a behavior, apparently. They talk about exposure therapy a little bit and cognitive behavioral therapy. They say with CBT, cognitive behavioral therapy, to identify and correct distorted thinking about the self, others, of the world, which also changes your own behavior. And you replace those beliefs with more realistic and positive beliefs. The next section is medical treatment, and they can use drugs to influence the brain. They have stuff like antipsychotics, anti-anxiety medications, antidepressants, and stimulants, which often help to stabilize the behavior and the mood so that other methods like individual and group therapy can be used. Combination of meds and talk therapy are often the most effective methods. And the other section, Electroconvulsive Therapy, or ECT, used to be called shock therapy, is where they induce a mild seizure by delivering an electrical shock to the brain. Now, treatments last less than a second. The patient is given an anesthetic to numb the pain. It is done to treat severe depression when other methods of trying to treat that have just simply failed. And the side effects can cause impaired short-term memory. So there are some pros and cons to that, but if you're pretty miserable, I guess that it works for some people. So there it is, ECT, electroconvulsive therapy. And then the last area is, does therapy work? Well, of course, therapy does work. Psychotherapy plus medications, whether voluntary or involuntary. They have natural recovery, which could be related to nonspecific events like a relationship and trust with the therapist. Just having somebody that you can trust might help you get through something that you couldn't otherwise get through. Anyway, that's the end of our talk right now. We're going to keep things short and sweet and hope that you get an A on the test. Good luck.